Why is my baby pulling their ears? Your baby is growing and developing at the blink of an eye. Each day you watch them explore and do new amazing things that fills you with joy. But recently, you've noticed that your little one seems to be constantly pulling and tugging at their ears. As innocent as their new fascination with their ears may seem, it could be an indicator of something more serious. But how can you know for sure? And what can you do if you suspect something might not be quite right? Let's find out. Hello, and welcome to MedTouch, the best place to find the right medical information. If your little one is pulling, tugging, or constantly grabbing their ear, then you probably have a few questions. The first being, what's causing this behaviour? Infant ear pulling is common, especially between the ages of 4 to 12 months. It may also continue to occur up until the age of 3. If your baby doesn't have any other symptoms and seems generally well, then their ear pulling is most likely due to harmless causes such as discovering their ears for the first time or as a way to self-soothe before sleeping. However, if your baby has a fever or other symptoms that may indicate they're unwell or in pain, then ear pulling may be the cause of something more serious, such as teething pain, a foreign body in the ear canal, a ruptured eardrum, or an ear infection such as viral otitis media, a viral infection of the inner ear behind the eardrum, bacterial otitis media, a bacterial infection inside the eardrum, or a bacterial or fungal external ear canal infection. How to determine the cause? Teething pain and ear infections can be hard to differentiate between as they share many of the same symptoms. If your baby has recently started teething, they may be pulling their ears out of frustration or irritability. This is because the nerves in the teeth and mouth branch out to the middle ear, which can make your little one feel as though their teething pain is coming from their ear instead of their mouth. Teething pain is also more likely if your baby is drooling more, is touching or putting things in their mouth, or if they have a teething rash around the mouth, cheeks, chin, or neck. On the other hand, an ear infection is more likely to be the case if your baby has a cold or flu and has symptoms such as a fever, vomiting, redness on the outside of their ear due to touching or pulling, or enlarged glands around their ear. They may also seem more restless and irritable when lying down, and they may avoid sleeping or positioning their head on one side. If your baby's eardrum is red, tender, and leaking thick or bloody discharge from the ear canal, they may be pulling their ear due to a ruptured eardrum or a foreign body inside the ear canal. It's important that you call your doctor immediately if your baby has any of these symptoms, particularly a fever and drainage from the ear canal. Your doctor will be able to diagnose and rule out each of these possible causes through direct visualization of the ear canal, eardrum, and through assessment of your baby's symptoms. What treatment options are available? Non-steroid anti-inflammatory medications are the first line of treatment for teething pain and viral ear infections. For bacterial infections of the middle ear, your doctor will prescribe your baby with antibiotics to control the infection, as well as non-steroid anti-inflammatory medications to reduce inflammation, control fever, and provide pain relief. For external canal infections, your doctor may use a combination of ear drops to settle inflammation and control the infection, as well as non-steroid anti-inflammatory medications to control fever, pain, and inflammation. If your baby has a foreign body in their ear canal, your doctor will promptly remove the object and then re-examine the ear to determine if any injury has been caused. Antibiotic eardrops may also be prescribed to treat any infections that may have occurred. Lastly, if your baby has a ruptured eardrum, your doctor may prescribe topical or oral antibiotics and advise you to take extra care. They'll also arrange further follow-up appointments to ensure the eardrum is healing correctly. Ear infections may take a couple of weeks to clear up, and although it may be tempting to do so, don't put anything into your baby's ear that hasn't been prescribed by your doctor. This includes cotton buds and over-the-counter eardrops. We know that seeing your little one in pain is very worrisome, but with proper treatment and care, they'll be back to feeling like themselves in no time. Thank you for watching. Please like, comment, and be sure to subscribe and click that notification bell so we can stay in touch.